Disclosures for this and all episodes in this series can be found on the podcast series destination page located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast is supported by an independent educational grant from Moderna, Inc.
Hi, my name is Dr. Megan Pesch. I'm a developmental and behavioral pediatrician at the University of Michigan. I am also the director of our congenital cytomegalovirus developmental follow-up clinic. Welcome to this podcast episode, Testing Positive After Birth, One Family's Journey with CMV. This is a part of a 6-episode podcast series called Let's Talk CMV. Today I'm speaking with Samantha. Samantha, you and I know each other, but for our listeners, can you tell us a little bit about yourself and your family and your experiences with cytomegalovirus or CMV?
Thanks. And thanks for having me here today. As you know, I have a daughter. Her name is Evie, and she's about 21 months old now. She was born with congenital CMV, and I had only heard about it once she was diagnosed, even though I had worked in healthcare research for years, including research in neonatology with very sick and premature infants.
Gosh, yeah. I mean, you're definitely in the majority there. Most people haven't heard about CMV, even though CMV, a cytomegalovirus, is very common in people. And I mean, you know this, but for our listeners, if they haven't listened to other episodes yet, I also have a daughter with congenital CMV. And although I had heard of CMV, I also didn't know much about it. So anyone can get CMV at any age. Many kids become infected before they turn 5, but most adults will end up getting it before they're 40. And so, Sam, can you tell us a bit about your experiences before your daughter was born?
Sure. So I had actually heard of CMV, but I had not heard of congenital CMV. I had informally known about CMV from my experience working in an infectious disease research lab. So I had heard of it on a professional level, but not about what it can do to babies. Around that same time, though, I had donated blood and they told me I was CMV negative, but I didn't really know the significance of that information at the time until I had my second daughter years later. But before she was born, my OB and my pregnancy team never discussed CMV with me. I was not educated on the risks associated with acquiring CMV while I was pregnant or ways in which to prevent acquiring CMV while I was pregnant.
Gosh, yeah, I wish your story wasn't so common, but that totally resonates with me. So just so our listeners know, once someone catches CMV, the virus stays in their body for a lifetime, kind of like the virus that causes the chicken pox or shingles. So it goes dormant, but then it can reactivate. So there are different types of CMV infections that we talk about. A primary infection is when someone gets CMV for the first time. A reinfection is when someone gets infected again, but with a different strain, kind of like we see with the flu or COVID right now, unfortunately, different strains of CMV go around. And then reactivation occurs when an earlier CMV infection that's been lying dormant in the body becomes active again. And so congenital CMV is when a fetus or a baby growing like in a mother gets CMV. And so that's passed from the mother through the placenta to the baby. That is different than what we call perinatal CMV or postnatal, which is anytime a baby or a child gets CMV, after they're born. So kind of going back to your story, Sam, how was your pregnancy? Was everything seemed okay, right?
Yeah, everything seemed okay with my pregnancy. I had like the general, illnesses and symptoms that most moms get at some point during their pregnancy. The only real significant thing that happened was I went into preterm labor about 4 weeks early, which isn't, totally uncommon. And she was really small when she was born. She was about 5 pounds, but again, that wasn't surprising considering she was 4 weeks early. She had no visible signs of any significant illness when she was born. There were no obvious signs that she had congenital CMV. The only sign that she had was that she failed the newborn hearing screen in the hospital.
So that is really common. Most babies born with congenital CMV, and again, that's when the mother passes the virus through the placenta to the baby in utero. Most babies that are born with congenital CMV just look perfect. They don't have any signs or symptoms at birth, but we do know that very often they can develop symptoms or complications later. So things that might not be obvious at birth can be intracranial or like lesions or involvement of their brain. We see a lot of babies that develop hearing loss even into childhood. Um, developmental delays. Some kids will have seizures. So there's really a whole host of things that can happen even though these babies look completely perfect.
Right, exactly. And that's exactly what happened with my daughter. Um, she had the newborn hearing test and she failed, but they said that this can just happen sometimes and to not worry too much. And they'd repeat the test again the next day. When they repeated the test, we got the same results. So that's when we were referred to an audiologist for follow up testing within the next month or two, they recommended. Um, so when we went for the follow up testing a few weeks later, the audiologist found the same response, which meant that she had no auditory brainstem response because, babies can't raise their right or left hand to indicate that they can hear a sound.
Like the beep. Yeah.
Right. So they put these little electrodes on their forehead and their scalp to measure if the auditory nerve is providing any type of response to an auditory stimulus. Um, then after she failed the follow-up testing, we ended up getting referred to a larger institution. At that time, I still hadn't heard of CMV. Most of the conversation had been about a potential underlying genetic cause, but there is no history of genetic hearing loss in my family, but that doesn't mean it doesn't exist.
Sure.
But when we went to the larger institution for follow-up confirmation testing, they, one, confirmed the evidence of hearing loss, and two, was the first time I heard of CMV being mentioned as a potential cause. So they collected some blood and some urine for additional testing to screen for the most common causes, which includes some genetic causes, but also includes CMV. So they tested her for CMV antibodies, which came back positive. But this wasn't meaningful because this was after she was 3 weeks old, which meant that she could have just acquired the infection after she was born, like you mentioned, a perinatal infection, which doesn't really carry significant risks to a baby. So then at that time, I didn't have any good information as to what was causing her hearing loss. And I was sitting at home one day and you called me.
I remember that. Yes.
But I do want to mention that the timeline for the follow up in regards to the failing the newborn hearing screen in the hospital does not match up with when kids need to be tested for CMV.
That's a good point. So babies need to be tested for CMV as soon as possible after they're born. So definitely within those first 3 weeks. That's when we can tell if it's a congenital infection, which can be really serious. But after 3 weeks, it's hard to know, did they acquire it from big sister giving them a big kiss on the lips or breast milk, which if a baby catches CMV after they're born, for the most part, babies do great. They don't even seem sick and they don't even get sick unless, they're in the NICU or there's some other circumstance. So with Evie, I remember she was a couple of months old, and we still wanted to test her urine to see if the virus was there at all. And it was. And then I remember we got her newborn dried blood spot. So, what was left over from that heel poke testing, the first day after she was born, and we sent that out for testing, and it came back positive. It was quite the journey.
Yeah, it took a long time. And as a parent with a newborn at home, there's a lot going on. You're really busy, you're really overwhelmed, you're really sleep deprived. And then to add on this layer of unknowns, and you don't really know what's going on with your kid, if there's something wrong, if your child might require treatment of some kind. We already knew that she was going to need intervention and treatments for her hearing loss, but we didn't know if this meant that there was something else going on alongside of it too, and what those meant long term for her. So the follow-up testing for the hearing loss and testing with CMV at the same time, the CMV testing really needs to be done sooner, probably in the hospital, instead of waiting until they get the follow-up hearing screen done.
Yeah, totally. And CMV is so common. Most people do end up catching CMV at one point in their life, so having it is really no one's fault. CMV, it spreads really easily through bodily fluids, so blood, saliva, tears, urine, vaginal fluid, all the breast milk, all of that. Um, but for adults that have CMV, most won't know it because most don't even have symptoms, or they have very mild ones. Like they might have a little bit of swollen lymph nodes or fatigue, but most of the adults who get CMV are totally asymptomatic. And so a lot of folks don't get tested for it. I mean, really, in an adult who's otherwise healthy, there's no recommended treatment. So testing isn't really standard of care right now, and that makes sense. We do recommend that people talk to their doctor about testing, but testing in healthy adults isn't really standard of care right now. And for babies, though, we do recommend that people talk to their doctor about testing for their newborn, especially if their newborn has some possible signs of CMV, like hearing loss. And I think, just knowing about CMV can be really valuable.
Absolutely. I agree with you 100%. I wish I would have known about CMV beforehand, before I became pregnant, ideally, but if not, even at some point during my pregnancy, when they do general prenatal counseling, in the first trimester would be great. I think moms have the right to know about CMV. They have the right to know how to prevent CMV. Not providing the information is, I think, only doing a disservice to a lot of children. I wish I would have known about it so I could have done more of my own research. I could have talked to my family about it.
How do you think you got CMV? Do you have like a theory? Because you knew you were negative a few years before.
I do. And I've heard that primary CMV infection, as you've mentioned before, which is like the first time you get the infection, is a higher risk situation in terms of it being transmitted to your baby. I wish I would have known that. I had a toddler at home at the time. And as I've come to learn, toddlers are little incubators for CMV, especially if they're in daycare and they're with other kids all the time, just swapping germs all the time. That's just what they do. If anyone has a toddler at home, you know this. They're sick all the time. They have runny noses all the time. So it's likely that I got CMV from my toddler, especially when you're pregnant. You often eat your toddler's food that they don't eat. You're hungry. It's just sitting right there. It's easy to just, pick up that leftover piece of toast or whatever it is and just eat it.
Absolutely. But you don't think that their saliva could be on it. If you're not aware of CMV, you're not thinking, "Oh, I should avoid my child's saliva, so perhaps I should make my own slice of toast." It's just not on your mind if you don't know. Things that I also wish I had known. So, things that other people can do to lower their risk of CMV. So things like not sharing food or drinks, especially if you're pregnant or even thinking about getting pregnant, or if you have a weakened immune system, for sure. Some of the common ways that CMV spreads can be through, so we said bodily fluids, through the saliva or urine of toddlers, kisses on the mouth, or sharing food, licking the same ice cream cone, utensils. Babies can get it through breast milk or, as they're being born. And again, that is actually not so concerning. It's when they're in utero is when it can be kind of the most harmful. People can also get CMV through, like blood transfusions or, sexual activity, but it's really, really common among young children at passing it to the people that they have close contact with. And I also want to mention that like casual physical contact, like hugging or holding hands, or even like kissing on the cheek or forehead, very rarely spreads CMV. So it's just that bodily fluids piece.
And for other moms out there, a few that I think would be good to know are, like not putting a pacifier in your mouth if your toddler still uses one. Making sure you're really diligent about hand washing after changing diapers, even just, a urine soaked diaper. Um, yeah, like you said, kissing on the cheek instead of the mouth. Sometimes it might be hard to avoid some of those slobbery kisses, but
Well, you do your best, right? Like if you know about CMV, then you can choose if you want to, try to implement some of these things. Like I just think like knowledge is power. It's so important that women know and then they can make educated decisions, right? And then all you can do is try because that toddler saliva, urine, snot, we all know it's everywhere.
right. And I think having the right to know is the big thing. You do like this mental time travel and you think, what would I have done differently? And certainly there's a lot of things I would have done differently. And maybe I would have gotten CMV anyway, but at least I would have tried.
Right, totally. And like I know personally, I live with a ton of maternal guilt. And even though I know it wasn't my fault, if I don't know how my daughter got it, if it was a reactivation or whatnot, but same thing, like I wish I would have known at least because I mean I was like that mom that went like totally organic. I like cut out coffee, which was the hardest thing I've maybe done in my life. So, um, yeah, I think everyone should know, and it should definitely be reinforced, especially with higher risk moms. So people that work with kids and people like dental hygienists or nurses, physical therapists, speech language pathologists, like gosh, people that work in daycares, teachers, those people are, and moms, right? Moms of toddlers definitely at the highest risk.
Right. I totally agree. I definitely would have wanted to know. I think most moms and people working in these professions, like you mentioned, would want to know. Knowledge is power. I don't think there's a person out there who'd go, no, I don't want to know about this. And I think it should be emphasized that moms are really, especially during pregnancy, there's a lot of things that they can or can't do. There's a lot of things that they're educated about. Like you mentioned, you cut out coffee, which I'm very impressed by. But
Okay, I like cut down. I cut down on coffee.
but there's a lot of things we can't do. We're educated that we can't, a good example that I like to bring up is the kitty litter one.
Hmm.
Because that to me is sort of akin to like diaper changes. Like, okay, you can't scoop kitty litter, when you're pregnant because there's this risk of toxoplasmosis.
Mhm.
I didn't even have cats at home, and this was mentioned to me multiple times. But not once did someone mention CMV. You can't eat deli meat, um, no raw fish, all of those things that any mom would be familiar with. But no one mentioned CMV. No one asked if we had other kids at home who might put us at risk for it. I mean, it was just never mentioned.
Same here. And it just feels like something that, should at least be thrown in there. So then people can make their own decisions.
Exactly. I'm not saying those other things shouldn't be mentioned either.
Right. 100%. So there are a lot of ways that people could get CMV before they're pregnant or during pregnant. So I really encourage people, ask your OB, ask your doctor about CMV and, things that you can do to lower your risk. So, Samantha, can you just tell our listeners a little bit about how Evie is doing now?
Yeah, I'd love to. So she's doing really great. She got her cochlear implants when she was 9 months old, and they were activated when she was 10 months old. So she's been hearing for actually a year as of today.
Wow, that's incredible. Oh,
And she has, I would say, a little more than 10 words. Her newest one is that she said chicken yesterday.
amazing. Sam, this has been so fun. Thank you for joining me today. It was really great to talk to you, and I appreciate you sharing your story and being so open. So thank you.
Thanks for having me.
And thank you to our listeners as well.